Hey everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics. I wanted to show you this case because I think it has some excellent teaching points to it. And first, before I show you too much about it, I just want to say right off the bat that when it comes to orthodontics, oftentimes more can be done in the mouths of children than in the mouths of adults. And what this case really shows is what's possible in the mouths of adults, especially when they're amazing patients. So this is Amanda. And Amanda came to us looking for a nicer smile, and you can see some very misaligned front teeth right there. This is a close-up of Amanda's bite, and again you can see the discrepancy between some of the upper front teeth. One of the things that I talk about a lot in my educational videos is deep bites, which means that these upper front teeth are completely covering the lower front teeth. You can't even see any of some of these lower front teeth because they're overlapped so much in a vertical way. And this is something that can really cause a lot of undue wear on teeth. When the teeth overlap too much, the lower teeth are taking too much of the bite forces and they get really worn down. And by the time you're a middle-aged adult, they can be worn down to little nubs, and then it's very difficult to do anything with them at that point. So that was another one of the things that we wanted to try to treat. This is what we call an occlusal view, a view from the tongue of the upper teeth, and you can really see again the discrepancy between some of those upper front teeth. And these are the lower front teeth looking down on them, and significant crowding in the lower anteriors. One of the reasons why we really like to fix lower anterior crowding is because we know that really crowded teeth only get worse over a lifetime, and really crowded teeth are very difficult to clean. So there's an increased risk of cavities, there's an increased risk of gum disease in places where it's difficult to clean. And then the other thing that was unique to Amanda was the extent of overbite. And it's a little bit hidden because one of these front teeth is way tucked back and the other one is kind of flared forward. But simply put, there is a large overbite here. And this is really the most significant change that we saw in Amanda's case, and you know what really kind of clued me into what's possible. So if I show you this, I drew these two little red lines, and these red lines in an ideal bite should line up. And so when we look at this, this is a large magnitude of change. This is kind of like every tooth is a whole tooth off in the bite. And in kids, I think that this is generally, in growing kids I should say, this is generally something that's able to be fixed. In non-growing adults, this is something that is incredibly difficult to fix. The magnitude of change here is just too much. And so in adults, I don't expect full correction of these kind of overbites, but you know what? It's worth trying to do as much as we possibly can. And the more overbite that we can close, the better, the better it looks, and the better the bite fits together in the back. So here's what we were able to accomplish. We first of all, let's talk about how we accomplish that. Generally, whether it's a growing child or a non-growing adult, we can hook up rubber bands. In this case, Amanda wanted to pursue treatment with Invisalign, so we used clear aligners to fix Amanda's bite, and I felt confident that Invisalign was going to be able to fix everything that we wanted it to fix. The only thing that I was not 100% confident in was, would it take away all of our overbite? But whether it was braces or Invisalign, I wouldn't think that all of her overbite would go away anyway. And with Invisalign or with braces, we can hook up rubber bands in this fashion. So the blue is kind of simulating the rubber bands. There's a little slot in the aligners up here where the rubber band hooks into, and a little button that we'll put on the back teeth. And simply put, it's taking upper teeth and moving them backwards, and it's taking lower teeth and moving them forwards. And that's how we do bite correction. Well, when you have an amazing partner in treatment like Amanda, who wore her aligners at least 22 hours a day and wore her rubber bands for at least 22 hours a day, you can get full correction. So this is where the bite ended, and this is a strange perspective on the bite, but if I drew these red lines, they would pretty much line up right now. And this is incredible. Look at the overbite. It's pretty much completely gone in the front of the mouth, and I was truly blown away. I have not ever seen this magnitude of bite correction in an adult, but I probably have had very few patients as diligent and as willing to follow instructions as Amanda. And so I put Amanda in my Hall of Fame for Invisalign patients. Truly some absolutely remarkable results, as you see from her smile here. Here are some comparisons of what we were able to change. So these again are the lower teeth. And if you look at how crowded those lower front teeth were to begin with, and now they are perfectly straight. The upper teeth, again, some huge discrepancies between the position of those upper teeth and now perfectly straight. This is the bite. Look how much of these lower teeth we're able to see now. So we've opened the bite and made a lot less overlap between the upper and the lower front teeth. This has given her a healthier bite long term. So amazing changes there. And then most amazing of all is watching that overbite go away. So look at the distance from, say, this upper front tooth to the lower front teeth. That's a long ways. That's 7 or 8 millimeters, and now we're back down to 1 or 2, which is pretty much perfect. So absolutely incredible changes. I'm super proud of Amanda, and if you see the difference in her smile there, man, she's happy about this too, and this is definitely something to smile about. So it's been fun watching her gain confidence in her smile. This is truly one of the best Invisalign cases that I've ever had a privilege in doctoring, and I certainly could not have had these amazing changes without an amazing partner in treatment that was Amanda. So big credit to you, Amanda. I am so happy for you, and like I said before, Amanda is in my top 5 all-time best Invisalign patients with the results that she was able to get. And so I say this with braces, I say this with Invisalign, I say this to every single person that starts treatment at Joosse Family Orthodontics. Good treatment requires good partnerships, and my end of the partnership is to treat you like you're my family, and we're going to do everything we can to give you a perfect result. But it also requires some work on the part of the patient, and in this case we had a perfect patient who wore her aligners exactly as prescribed and wore her rubber bands exactly as prescribed and got all the changes we could ever imagine and more. So congrats to you, Amanda. Thanks so much for listening.